Thank you very much, Dr. Marsha, for this little interview for the Alaccsa R News. Tell us about the real future, in your opinion, of this kind of technology.
I think this sort of technology has an enormous future because for the very first time we can tailor treatment regimes to individual patients. So now we have the ability to determine patients at very high risk of severe complications in terms of refractive surgery. So the Avellino test is really simple. It's a buccal swab, goes away to a laboratory, and then you can operate or not with confidence depending on the outcome of the test.
Will we do for every patient, in your opinion?
In my opinion, given the efficiency of this test, and it's not terribly expensive, we would certainly start doing it for every patient in refractive clinics because the risk of not doing it is really high for the patient.
Which is the sensitivity of the test and the specificity?
It's very sensitive, very specific, because we're dealing here with dominant chromosomal defects. So it's really very, very efficient. It's probably the most efficient group of tests that we have in ophthalmology.
How? In which percentage?
Well, it's 100% if you have the genetic defect, and it's 100% accurate.
Okay. How invasive is this kind of technology, this kind of test?
It's not invasive at all. It's just a buccal swab each side of the mouth 10 times.
Just to know.
That's it. Yeah.
Okay. I am concerned about the possibility, as refractive surgeon, to know the prevalence of haze in people that we want to do refractive surgery. It's a very, very key topic for us, even for refractive surgeons.
No, I think that's exceedingly important and a very good question. So because the haze relates to TGF-beta, it may well be that we can develop this system to give you pre-warning of patients that are going to develop haze. So I think that's one issue. The other thing is that we may well be able to determine biomechanics of the eye with keratoconic diagnosis, but also those patients that aren't keratoconic but that have abnormal elastic constants in their eye. So this is something that the company is conscious of.
Which is the real way, or the final way in this kind of patients, but because for surgeons, corneal surgeons, to know the prevalence of haze and the prevalence of developed ectatic case is a key thing.
I know. It's absolutely key, and that's why this offers the potential for personalized medicine. Each patient will be screened, and then the doctor will have confidence, and the patients will have confidence, and fortunately, no complications. So I think this is absolutely the future.
When do you think that it becoming soon, or we are anxious?
It's very, very difficult to say when, but
in your opinion?
No, I mean, the science is moving very rapidly. We started with just 3 dystrophies. We now have 5 dystrophies. And because of our knowledge of the human genome, I'm sure that within a very short time we're going to see these developments.
Sounds good.
Yeah.
Thank you so much for this interview.
Thank you very much indeed. Thank you.
Thank you.